Hi there. How many of you have received a prescription and you go and pick it up and you're like, no one told me all these side effects. So anyways, we're going to talk a little bit about that today and how important it is to educate your patient when you are prescribing medications. Because as you probably know and have received medications before, sometimes you get them and no one ever told you anything about them. So that will then influence whether you're going to take it or not, if you're going to take it as prescribed or not. And this really helps reduce medication errors and also dispelling rumors. Let's go back to flu shots. How many rumors are out there about getting flu shots? So this is where the advanced practice nurse prescriber really stands out. And I really say that, and I'm not trying to put all physicians out of that, because there's some awesome physicians, but nurses are known to be really good educators. And so when we talk to the patient, we really should talk to them about what the medication is, why are you taking it, the purpose of it, how are you going to take it with or without food, what are the side effects, how are you going to store it, and let's say, for example, they're on a blood pressure medication. Hey, I'd like you to come back in a couple weeks because I really need to check your kidney function and your potassium, because this drug sometimes can increase your potassium or sometimes it can affect the kidneys. So we just want to make sure, and at least we're monitoring it, and so it won't cause that. Any food or drug interactions. Okay, I put you on a statin medication, some Lipitor. You really should avoid anything that has to do with grapefruit. So grapefruit juice, grapefruit in general. And how long are they going to take it? Written instructions are so important. As you guys know, with learning, active learning, there's a lot of people that need written instructions. You print it out. And when you're printing out things for patients, it should be at a 5th grade reading level. Make it short, succinct, bullet points are great. And if they do have illustrations, that'd be great, but not all electronic health records do. And drug monitoring. So again, it's that teaching. If you have any issues with this medication, again, let's go back to the statin. If you have any muscle aches, muscle pain, please call me right away and let me know. And then we can move further on that. We want to make sure that they're getting the right dose. We want to make sure that they're taking it as desired, because if you send a patient home on a statin medication and they have muscle aches, because of many people here, it causes muscle aches, which it can. Many times it'll end up going away. There's times where I prescribe it and I put them on it every other day for 3-4 weeks and they tolerate it fine. Then I move them up. So this is just one of the examples of why you're going to drug monitor patients. And you also want them to not overdose on the medications. You want them to adhere to the medications and take it as prescribed. I don't know how many times I've had patients without insurance, or there's Medicare patients that come in and I don't know if you've heard of the donut hole, where they end up having to pay full price for their medications. Sometimes you do get stuck between a rock and a hard place. You try really hard to find the cheapest medication for them, but I've had patients come in and say, I take my diabetic medication every other day because I need to save on it because I can't afford to get it filled until, say, January. So also look at, is polypharmacy an issue? You see many elderly people on a lot of medications. They're taking a medication because of the medication they take. So is it really necessary? So this all has to do with your responsibility for prescribing.